Here's why our patients at Well Health and Chiropractic attribute chiropractic care with saving their life. I'm going to show you why. Because the way that God designed this is that our brain and spinal cord control every single organ, cell, tissue inside of our body. Right? For example, these nerves right here are some of the nerves that go to the heart. So for the heart to beat one time, the message goes from your brain down the spinal cord, out these nerves to your heart. But the problem is these nerves are very, very delicate. There's a research article that shows that the weight of a dime on a spinal nerve has the ability to shut down 50% function to an organ. Right? So it's not good. So we pinch this nerve, it's going to shut down function of the organ. So what does that have to do with chiropractic care, Dr. Ben? Well, I'll tell you why. Because if you have had any whiplash in your life, it will absolutely rip the ligaments in your neck, and that is what causes your nerves to be pinched. So your neck is supposed to have this nice good curve. There's 7 ligaments front to back. And when these ligaments are stable, your spine can bend, lift, twist, and move, and there's no pinches or pressures on your nerves. But when you have a whiplash, right, we've all done it, sports injuries, car accidents, wrecked on your bike, rollerblading accident, flipped a four-wheeler, right? That's what happens is you wind up ripping these ligaments. But let me show you what this looks like on x-ray. Right? Can you see this person here? That is what this looks like on x-ray. This is not normal and you don't want that. Let me show you what that does. And this is a problem here, is that people think that arthritis just has to do with how old you are. Or my dad's got arthritis, so I'm going to get arthritis. That is not true. Arthritis starts when your ligaments rip. If you have a whiplash, you immediately need to go to your chiropractor, and that's what we do by your corrective chiropractor. We don't just randomly adjust your Well Health and Chiropractic. We work on the muscles, ligaments, and tendons through a very specific treatment protocol. Most of our protocol also actually uses red light therapy to stimulate the healing of these ligaments, but you can see, look at this. So this neck is straight. These ligaments have been torn. Now look, what we're looking at here very specifically is you see that little spike that comes in front of that vertebra? And this is kind of like weird shaped right here. That's arthritis. This patient is 45 years old with arthritis in her neck. And this is something that's a her, you can see your earrings here. Arthritis in her neck. These discs right here, that disc height is probably like 55 or 60% of what it's supposed to be. So she's 45 years old. This is what's going to happen. These nerves right here go to her thyroid. And she's been walking around with this old whiplash in her neck. That's a side impact whiplash we can see from where the ligament's torn. And she's walking around with this whiplash that's probably 25 years old, happened when she was 20, and she's 45. So it's like, oh, it's kind of painful, it's annoying, comes tingling in the fingers. She's probably feeling some thyroid symptoms because the nerves are pinched going to the thyroid. Fast forward, this patient will come into our office at 75 years old. I'm going to show you one of those here in a minute too. And those bones will completely grow. The discs will shrink. We're looking at surgery. This particular patient, by the way, has already had a lumbar surgery. And you can see, I don't know if you can see this from where you're at. Let's see if I can zoom in. Is you see this little spike sticking out over here? Oh, that's a disgusting lumbar surgery. You can see this big spike hanging on the side of the vertebra. That's arthritis. And that spike is because now these bones can't move because of that surgery. So the bones above it and below it have to really take the force, if you will, of movement. And because of that extra grinding, that's what grows the bone. That is what arthritis is. Okay, let's take a look at somebody who's older. And here you can see the arthritis in here. This is a mess. This is what happens when you have an old whiplash that never gets corrected by a corrective chiropractor. Remember, there's a phrase that says a rolling stone gathers no moss. Like a moving vertebra gathers no arthritis. So remember that, all right? This is a 44-year-old patient. You can see here, neck's completely straight. We're already starting to see a little spike there and a little spike there. Not a huge amount of arthritis, but your neck is not supposed to be forward like that. And obviously, that's not good. This is a 43-year-old patient. You can see the disc height between these vertebrae is starting to shrink. You can see right there that disc height is probably 45, 50, 60% of what it's supposed to be. And the thing that's interesting here, by the way, can you see how you're supposed to have a curve like this? And hers is straight right through there. That generally is somebody who's had like a bonk on top of the head. And you see something interesting. You see all the white in the back part of these vertebrae, it's like sticking up. Those are called your uncinate processes. Those are the facets in the back part of the neck, and those will spike up. So this patient is going to have a hard time, if she looks up towards the ceiling, her neck is not going to be able to bend back. which is crazy because that's such an easy fix with the chiropractic adjustment. We adjust those vertebrae and they work on the muscles, ligaments, and tendons so that she can be 80 years old without a massive amount of arthritis. But if she doesn't get this fixed, let me show you what that looks like. What happens when you don't fix that? Can you see right there, these disc spaces, they're very small now. I mean, there's not even much there. And you can see the back part of these vertebrae are like fusing together. That's arthritis. And I actually talked to this patient earlier today. And she was somebody who also was having a hard time moving her shoulder up like this in the air. And that's also partly because these nerves going to the shoulder are being pinched. And Dr. Moore here in Brentwood is working on T1, which is this area down there, and her shoulder's starting to move again. Again, don't wait until the arthritis is there before you fix it. And here's the thing, arthritis is growing. So the second that you tear those ligaments, arthritis starts. The second that we start working on rehabbing the ligaments, arthritis stops. So when would be the best time to get your adjustment? When you're a little kid. That's why we want families to come in and get care, because you don't want to wait until it's full of arthritis before you deal with it. So this is a 23-year-old with 20 years of arthritis in the lower part of her neck. This is insane, right? And you see how that's forward? I mean, this woman, she's really got some issues here. She's way forward. You can see with her spine. And when I look down here at 23 years old, this is bad. You can see the disc height is very, very small. What's called George's line. You can see these vertebrae are forward like this. You see those white spikes? That's those unstable process. 23. This is a 23-year-old. This person, when she's 53, is going to be full stage 3 or 4 degeneration in that spine. Will barely be able to move her neck, and all those nerves go to the arms, shoulders, hands, heart, lungs, and thyroid. We're not making this up. This is hard science. This is a 60-year-old patient with a 50-year-old arthritis. This is what you do not want. Look at this. This is terrible. So these vertebrae aren't terrible. You can see the spaces between those bones not good, or not terrible. Look at that. There's only like what? Maybe 15-20% of that disc height left. That is not what you want. You see these big spikes that come out? That's arthritis. The reason that arthritis is there is because these ligaments rip, and now these vertebrae can grind, and it grows the bone out there, and that's what that arthritis is. Again, these nerves right here, that's going to go to the thyroid, arms, shoulders, hands, heart, lungs. This is a 60-year-old woman. This is not good. So this is going to be somebody who generally they're going to come with high blood pressure, thyroid issues. There's no way she'll be able to turn her neck without pain. Now, as we adjust her, we can preserve the best we can to preserve what's left of that disc. This lady needed to be getting adjusted in her 20s. So that's why we encourage everybody to get adjusted as soon as you can, as early as you can. This month's chiropractic special sauce. Let's talk about the lumbar spine adjustment. We've got our wonderful model here, Miss Taylor, in our Brentwood office. Everybody say hi to Miss Taylor. Thank you for letting us use you for your body. Anyway, so what we're going to talk about is what we do that's special, unique, and different with our lumbar spine adjustment that we teach all of our doctors and you're going to get to see. Number one, let's talk about the mechanics of the lumbar spine. So the lumbar spine has this very interesting properties. We have these little bumps that come up here. These are the facet joints that are part of what's called our mammillary processes. So what those mammillary processes do is you can see the spine doesn't want to rotate. It doesn't want to bend to this or rotate to the side. So what we want to do, and a lot of chiropractors don't do this, is we want to put that lumbar spine into what's called flexion. See what I just did there is open up those joints. And then when we go to rotate the lumbar spine, we rotate the lumbar spine. And that allows those joints to be wide open and that adjustment to be smooth. A lot of chiropractors make this huge mistake. And what they do is they'll put you in this, and I'm going to show you on Taylor, I'm not going to do the wrong thing, but I'll show you what that looks like, is they'll actually keep the lumbar spine in extension, and when they go to adjust, these bones ram into each other. So it doesn't work. But what we're going to do is we're going to put her into flexion, so that way we can just real easy adjust that spine. So first thing that we do for our special sauce here is we got to get the patient in a perfect position. We use a phrase in our office, it's called fast is slow and smooth is fast, okay? So we're not going to rush anything. So I'm going to put her right where we want to, her hip. I'm going to pull her shoulder out just a little bit. I'm doing something really unique here that most chiropractors don't do, is I'm actually holding her leg up with my leg, okay? And the reason that I'm doing that is because I want all these muscles in her back to be super relaxed and loose, as well as I want this muscle on the side here called your TFL to also be relaxed. Because a lot of chiropractors, what they're going to do is they're going to come over on a side posture, if you've had this ready, and they're going to do this, and they're just going to push you down like that. What's that feel like? Look at her face. You see it? Not happy, right? Is anything in here relaxed and excited?
No.
That's basically keeping her in extension, and we're going to be pulling that lumbar spine apart. We do not want to do that. So what I'm going to do instead is I'm going to keep her leg up here, and this is how all of our chiropractors adjust. I'm going to stack her shoulders, and what I'm going to do is we're going to put her into flexion. Did you feel that I go into flexion? It's nice, isn't it? All right, and then from here, I'm just going to put her, put her into my house. I'm going to put her right like this, and then I'm just going to give it a little bump. Good, just like that. Did you feel it all move?
Yeah.
And that is a proper chiropractic adjustment, and that's what we do here at Well Health and Chiropractic. All right, so next up, I want to promote our new podcast. It's the Well Health Show, starring yours truly, Dr. Ben. If you just can't get enough of what you learn in here, and you'd like to learn more tips and tricks, nutrition, exercise, how to feed your kids, let's see, the last one we did is the 5 things that I personally do to reduce stress. You can tune into our podcast. Every Wednesday, we drop a new episode in the afternoon. We do shorts throughout the week on both Instagram, Facebook, YouTube, Meta, all the things. Tick, Smash, and Snap something. Who knows? I don't even know what they are. But you can grab it. It's going to be awesome. It's going to be the Well Health Show starring yours truly. And I have this microphone, and it actually works, and it's great. And I would love for you to subscribe, to join, to pass along to your friends. We got a big mission to help get our country healthy and our world healthy, because that's what God's designed for you. Well, hey guys, this month's product of the month is our Redmond Real Salt Relight Hydration Drink. Listen, dehydration is a real big thing, particularly right now. As we go from the fall time to the winter time in your house, your heater kicks on. And if you're like us, we notice that when your heater kicks on, it sucks all the water out of your house, and then you get real dry. So that's the time, like my kids will even get nosebleeds sometime. You get crack in your lips and around your fingers. Well, one thing that you can do to prevent that is actually super hydrating yourself. So we love this salt. Now, some people say, well, salt, is that going to increase my blood pressure? And the answer is no, it won't. So table salt is sodium chloride. This is not sodium chloride. This is going to have trace minerals in it. Specifically, you're going to have magnesium and potassium. So listen up, ladies. Magnesium particularly is going to be really, really good sleep aid. So this is going to really do 3 amazing things for you. Number 1, it's going to pull hydration into your cells with water. Number 2 is it's going to be remineralizing you. So that's going to be anybody's got kind of like a restless leg type of thing. You need those minerals to get your nerves to fire, because your nerves are calcium ion channels. So you need the nerves to fire. There's calcium in here as well. And then finally is that magnesium is going to help soothe your hormones and allow you to sleep better. We love this stuff. It's fantastic. How it works is it's just a powder. You get a glass of water, room temperature. You put like a whole scoop in there. Then you can put more or less in there. It's salty, so it tastes salty, but it tastes good. This one's watermelon lime. It's my favorite one. My kids love it. As a matter of fact, if I make a glass of it, I generally have to make 2 glasses of it because the kids will just steal mine. And so what we do is I'll make a glass of it, and then I'll put the water in first, room temperature, mix the salt in, and then I put the ice on top of it, because it's going to go in solution better at room temperature than it will with cold water. Fun little story with this one. Our COO, Sean, who works for us, and some of you might have met him, he sometimes will deal with like a sinus congestion headache, and he drinks a lot of water, like a ton of water all day. He's like, I don't get why I'm having these sinus headaches. I'm like, man, it really feels like you got a dehydration headache, because he's getting adjusted. And so he started doing the salts, and he noticed his headaches just basically went away because it was actually rehydrating into his cell. Hey, Taylor, pop quiz.
What's that?
What's the best day of the month?
I don't know, Friday?
Nope. Free X-ray Day. November 19th and December 17th. Taylor, why is Free X-ray Day so amazing?
Because you can invite your friends and family to come in, and they get a free exam. We get some x-rays. They get to try out our red light therapy bed, all for free. And then if they decide that they love us and they want to get an adjustment, it's only $40.
Wait a second. You get what for free?
You get a free exam, free set of x-rays if they're necessary, and a session in our red light therapy bed.
That is incredible. If I liked somebody at all well enough to save their number in my phone, I'd bring them to free x-ray day. That sounds fantastic. I just got a quick question for you. When you come in for a free x-ray day, is it just like a normal day, or is there maybe like some food and goodies lined up for them?
Oh, we have lots of goodies. We like to bribe people with food because everyone loves food.
Fantastic. I like food. Do you like food? Fantastic. So I'm going to encourage everybody this month, let's make it the best free x-ray day that we got. So November 19th, of course, the next one will be December 17th. In all seriousness, we do this for our community. We love it. We know there's always a time where you start as a patient and you get used to being a patient here, and you want to invite your friend, your neighbor, your sister. And like, when do you do that? Well, free x-ray day is our opportunity to bring somebody in. You get exam, consultation, full set of x-rays, and a red light therapy session for free. Should your friend want to get an adjustment, it's only $40. Best deal we got, right?
Yep, no harm, no foul.
Best day of the month. Thanks, Taylor.